Vaginal Family Viewing.
Ladies and gentlemen, welcome again to the Body Garage, the art of well-being. And today we have our doctor here that is going to take time and educate us all things about urinary tract infections, commonly known as UTIs. So welcome so much, Dr.
Thank you very much. Thank you for having me.
Pleasure. Now, before we go on, I would like you to just take a few seconds and tell us who you are and what you do and where we can find you.
Okay. So my name is Dr. Shamsa Ahmed. I'm a consultant physician, which means I deal with adult medicine, and I'm an infectious disease specialist. I am based at the MP Shah Hospital. I run the infectious disease unit and our travel medicine center.
All right. Before we skip right into what has brought us here today, many people don't really understand what the specialties are. So just talk a little bit about your specialty.
Okay. So first of all, when you say you're a consultant physician, what it means is that you've trained to deal with adults in all aspects of their health. Mm-hmm. So that means hypertension, diabetes, rheumatology, meaning joint pains, anything to do with anyone usually above the age of 15 years. Mm-hmm. Now, infectious disease, like it sounds, is mainly infection. Yeah. Anything that can make you sick, whether it is a bacterial infection, a virus, fungus. It can be a short infection, meaning like the way people get pneumonia, or even something that we're discussing today, the UTIs. Or it can be long-term infections, meaning things like HIV, hepatitis, TB. So that is generally the specialty. Yeah. Travel medicine covers things like vaccinations, or if you need to go to another country, what is it that maybe the medications you need to take, and how do you look after yourself when you go abroad. Yeah. It also deals with people who might need to travel into the country or out of the country to look for care that maybe is not available in their home country. Yeah. So that's generally what we do here.
Oh, pleasure. I guess now our viewers have a better understanding of what that specialty is about. So let's go right into the topic of today, UTIs, in full urinary tract infections. So what is this?
So the term, first of all, we say, what is the urinary tract? So the urinary tract, you can pretty much break it up into three components. You can start at the top and talk about the kidneys, which then come down into the ureters. Yes. Then the second part is the bladder, the one that we know that houses all the urine that the kidneys are making. And then the last part is what you call the urethra, meaning that is where the urine is flowing out. So when you talk about a UTI, what you're saying is an infection that can happen at any of those three levels in the body, whether it is in children, whether it is in adults, whether it is in male or female. And most commonly it tends to be a bacterial infection. I know we were talking about viruses and things like that, but the general thing that makes people sick is a bacteria that shouldn't be anywhere in those levels, getting a chance to go in there, multiply, grow, and then you start to see all the symptoms of what we call a UTI.
Yeah. All right. So what you're saying is that commonly most UTIs are bacterial. All right. So so therefore, let's look at how does it present. Like, what will I feel in my body that will make me suspect that I may be having a urine infection?
So like we said, remember there are three levels that you can get it. Now, one of the things with any infection, because remember your body has limited ways to show you that it's feeling sick. So generally you'll find you might have a fever, you might be feeling nauseous, you might be vomiting, and you might even have lower back pain, especially if the infection is higher up in the kidneys. So that would be general and non-specific. Like you wouldn't be able to say 100% the infection is in the urinary tract, but you know that these are signs of an infection developing. Then you'll find some people, you have pain when you have urination. And the pain might not be throughout the whole time you're urinating. With a UTI, especially if it is lower down, you get something that we call terminal pain, meaning you'll feel pain right at the end of when you're just at the end of, exactly, that is when you get that discomfort. Some people see a change in the urine color or smell, and you might even get a little bit of bleeding or blood, which is obvious in the urine. And then you have something we call frequency or urgency, meaning you'll find that this person keeps running into the bathroom to urinate, even though they doesn't feel like there's really anything in the system. But because of that irritation that's happening in the system, you'll find that you have this urgency to keep running. So you see, you can have general features, which could be for any infection. But when you start having that uncomfortable sensation and the pain when you're passing urine, then you know that the infection is likely to be within this particular system.
Now, there's something that you mentioned. Let me ask. So when my urine becomes like yellow, kind of, or reduced amounts, looks concentrated, should I also suspect that I have a UTI?
Usually, change in urine color generally can just be a change. It's a reflection of what's happening in your body. At the moment, it's been really hot in Nairobi. So if you're not drinking a lot of water and you go and you pass urine and it's dark colored, that might not tell you that you have a UTI. It can usually tell you the state of your hydration. Again, you'd have to tie it with other things before we say you have a problem with your kidneys or even possibly a problem with your liver. But if it is cloudy, looking a little bit blood-stained, and again having the other features that we're talking about, discomfort, you running to the bathroom, having fever, generally feeling sick, then you can say that's actually more likely to be a urinary tract infection.
So it's not one thing in isolation?
No. You see, everything has to be individualized. You see, even I can give you the 10 symptoms we expect, but you might not present with that. I might not present with that. I might present with 3 out of the 10. We usually tell people diseases don't read textbooks. So the one thing is, as an individual, you will know yourself, and it's very important for people to know themselves. And if you feel something is wrong with your body, don't just dismiss it or discuss it with your friends who then tells you, yes, I had someone who had this. If you feel something is wrong, even if you feel there's something wrong in the color of your urine or the smell of the urine, come in and get a checkup. You'd rather have actual information than just be running on, a suspicion or a feeling.
All right. Will you just summarize for us that part about let's say the 10 or 7 common symptoms that we'll expect?
So we'll say you'll have pain when you're passing urine. It can be throughout or right at the end. You might notice a change in color and smell of the urine. You might get blood in urine, what we call hematuria. You will have that frequency or urgency, meaning you want to keep running to the bathroom to relieve yourself. And then you might have low back pain, or you might even have pain just above the pelvis. And then now the general symptoms, meaning you can have fever, you can have nausea, you can have vomiting, and you can also just feel very lethargic and very weak.
All right, that sounds great. Now let's move on to something else. You mentioned that commonly UTI is mostly bacteria. So let's talk about the different microorganisms that could cause the UTIs, and let's narrow down to the common ones and how commonly they are spread.
So usually the reason we say it's likely to be bacterial is because normally what happens with certain bacteria, they're meant to be in certain places. The most common bacteria that causes a UTI is something that we call E. coli.
E. coli.
Now E. coli is natural around the genital area because it is a bacteria that you find in your gut. It may naturally be in the gut, but what happens, it gets a chance to go into the wrong place, meaning from the gut it now moves into the urinary tract.
Like now contamination in the pants.
Exactly. So now we look at who are the people who are likely to get UTIs. So number one, we say women are likely to get UTIs. Why? Because of the physical structure, the difference in anatomy between a male and a female. Just because of how the anatomy is arranged, for females you'll find that their urinary tract is right next to the genital area, which is right next to your rectum and where all the E. coli might be found. Then in a woman, you find that the passage for urine, what we call a urethra, is short compared to a man. So even if there was bacteria that had a chance to go up, with a woman, it's a very short distance that it can get into the bladder. Which is why a lot of time it's just the normal bacteria that you would be expecting outside that gets a chance to move. What can cause that? If there's poor hygiene, if someone is not holding urine, meaning you're not going to the bathroom as much as you should, even sexual contact. But remember, it's not a sexually transmitted infection, meaning your partner is not giving you the infection.
That's why I'm thinking we should talk about also.
What is happening, it is the physical contact that will happen during activity that allows that bacteria to gain access, okay? And that's what usually we call community-acquired infection, meaning it is something that you are picking up outside of a hospital, and usually that bacteria ideally should respond well to the treatment and the antibiotics. The other people we look at who get UTIs is if you have some congenital anomaly, meaning in that system I talked about, maybe there is something that you were born with, so those pipes are tight or small or have a valve that doesn't work or works in the wrong direction. So your urine, instead of flowing out, ends up being pushed back, or it ends up staying in the system a little bit longer. People whose immunity is low, especially diabetics, are likely to keep getting urinary tract infections. And pregnant women. Again, being pregnant changes what's happening with your anatomy inside. So the pressure of the baby on the bladder will also interfere with how you are passing urine. You see, even if you look at UTIs, babies, infants get UTIs. So that's clearly not sexual activity. But a child who is left in a diaper for too long, or depending on how you clean your child, ideally if you're cleaning, you're always supposed to clean front to back. But for those who might make the mistake of doing back to front, you are the one who's transferring normal bacteria.
You might want to explain to us that more, because many parents raise that concern when they're seen and they're told that their 1-year-old, 5-year-old girl, or even 10-year-old girl has a UTI. In their mind, they know that is sexually transmitted. How comes?
Yeah, so that's why we'll differentiate between urinary tract infection and sexually transmitted. So if we've established that this is bacteria that's normally found outside of the genitals, and it's just being opportunistic and getting a chance to go into the wrong direction. Now, if this bacteria is around your anal region or around your rectum, meaning where your child is passing stool, when you change the diaper and you decide to wipe your child from down going up, what you have done is, whether you've used a wet wipe or soap and water, what you have done is taken bacteria and transferred it onto where the opening of the urinary tract system is. So you're physically taking that bacteria, which is why now it takes that opportunity to go in the wrong direction. Or a child who stays in a diaper that is soiled for too long, again, they're just getting exposed. But in a child who has recurrent infections, especially that age group, it is good to see the doctor who makes sure that there are no anomalies in the tract of that whole system.
When it becomes frequent.
Yes.
All right.
Because ideally, if you had one UTI, you might say this was hygiene. But if you're getting, every 6 weeks your child is getting a recurrent infection, then there might be something more than just purely a hygiene issue.
Wow, good. Now, let's talk about more a bit why the diabetic people get infections, UTIs frequently, and also the elderly people.
So for diabetics, it's really quite simple. Unfortunately, with diabetes, it means your body is unable to deal with the sugar in its body. The way it gets rid of it is through the urine. Bacteria like sugar. So you end up having the same bacteria having a place that they can grow and having lots of fuel.
All right.
So that is why you find you get a lot of urinary tract infections.
So it's feeding on the sugar.
It's feeding on the sugar. And you see, usually a lot of diabetics, that's how they're diagnosed, because they keep going into hospital having recurrent urine infections. So then you might just be focusing on the urine infection, but you have to understand that there might be something else driving it. And then being diabetic and not well controlled, or even having other diseases, means you are immunosuppressed. Essentially, that means your immunity is not functioning at the level that it should. Most of us at some point will always have contact with diseases, viruses, so many things. Your body is constantly in a state of fighting off some disease. But when your immunity is impaired, then that's why you just have that break in the balance, so the bacteria or infection gets a chance to overwhelm your immunity.
Great.
For elderly people,
let's hold that thought right there. So we're going to take a break, and when we are back, we will continue the conversation on UTI, and we will pick right from why elderly people are prone to getting more frequent UTIs. So stay around.
You are watching TV 47, the home of untold stories.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics. Sabak.
This is the best way to go. Eat color, eat raw, you know, like this is alive.
Well, 2022 is behind us. 2023 is here with us. What are your plans? We here at TV47's Morning Cafe have great plans for you. We're talking about information, we're talking about entertainment, we're talking about the greatness for the year. So make sure that you're always with us every morning.
Kwa muonekano wao hauwezi ukajua waliopitia. Kwa sura zao zinapong'aa hauwezi ukafahamu changamoto zao. Nyuma yao ipo stori na historia. Katika kipindi Ufahamu Kiongozi, tunakupa nafasi kuweza kuwafahamu kila siku ya Alhamisi kuanzia saa 1:30 kuendelea. Nami Elizabeth Mutuku.
Your health matters, and Body Garage is.
Welcome back again to the Body Garage, the art of well-being. We are continuing with the conversation on UTIs, and Daktari is continuing to educate us. So Daktari, before the break, you were telling us more about why elderly people are likely to get frequent UTIs. So please, let's continue with that conversation.
so elderly people, again, one, their immunity is compromised just with age. Two, remember with age, unfortunately, your body structures are not as strong as they used to be. So a lot of people now start having problems with their bladder, meaning weakness with the bladder. And again, anything that interferes with the structure of that tract system will mean either you're keeping urine for too long, and so you're likely to develop infections. Elderly people also fall into a different category because they probably have other illnesses, and they tend to be admitted more than younger people. So now they move also into a category that we call hospital-acquired infections. Remember, you can come to the hospital for something completely different and get admitted. But the truth is, the bugs that we have in the hospital are always much more resistant and much stronger than what you will get outside of a hospital, just because of the antibiotics that are used. An elderly person might end up being catheterized. By that I mean, if they have a problem with passing urine, sometimes we put in a pipe into the bladder to help. So those are things that then contribute to an elderly person getting a urinary tract infection. And considering their age, they must have also used a lot of antibiotics in their life. In this country, it's very easy to get antibiotics over the counter. So usually you find there might even be a natural resistance that they have developed. So if they pick an infection, it might not be as simple as what we're saying, this E. coli that was just out on the skin. Sometimes it turns out to be a bacteria that is more hardy or more resistant. So that's usually what happens with the elderly.
Great. So let's talk about generally men versus women and UTIs. Any differences generally?
Generally, women are more prone, just because of what we said, because of the anatomy.
Yeah.
Because for females, the anatomy, everything is a lot closer, and their urethra is shorter. And then, of course, pregnancy is a category on its own.
Yeah.
The only problem with that is, I think then we start thinking it's okay for women to keep having UTIs. Meaning, if a man was to go into a casualty and be diagnosed with a urinary tract infection, you'll find there's a lot more energy put towards it, trying to understand why did he get the infection? Does he have an underlying issue? What can we do? Looking for other causes. Whereas with the female patient, she'll go have symptoms treated, and if you keep going to different facilities, no one even picks up on the fact that you're getting multiple infections, and maybe you will end up with consequences from having those repeat infections. So a man having an infection is less common than a female, and that should be a high alert thing, meaning they need to investigate and see why has he gotten that infection. But even for ladies, even if I say it's common, it doesn't mean that you should be having 2 to 3 UTIs every year. There's something that needs to be addressed further with that.
All right, so a little bit more about that. So let's say a man has been found to have a UTI. What would be the possible thing that will risk a man to have UTI?
So one, it could just be the one we're saying, as simple as the bacteria got a chance to go in. But for that, you need to investigate in a man anything that's causing his immunity to be low. Sometimes he might have even had a kidney stone, or what we call a renal stone. And because that stone will cause a blockage in the path, you can get an infection. And maybe at that point he had pain and the stone might have passed, and all you're seeing is the remnants of it. But for a man to have a UTI, we call it complicated. So we have to go and look at, is there a structural problem? Has he been exposed to some kind of bacteria that might be out of the spectrum? Does he have anything that is causing his immunity to be suppressed? So those are the things with a man that we need to be cautious of.
Will the prostate enlargement risk a man to have UTI?
So that again would go with the elderly. Now, the prostate, we know, is an organ that all men have. With age, there's a natural process that it becomes a bit enlarged. It's a natural process. But because when it enlarges, it is now interfering with the flow of the urine. So sometimes you find those are people who the urine is building up quite a bit. They're not able to control. So because you're building up urine, that means if there was any bacteria, it has time to multiply and grow within the bladder. So again, I would expect if it is a prostate issue, it would be in an older male, not in a younger man. And remember, prostate enlargement is not the same as prostate cancer. But you see, the symptoms can mimic in the sense that someone who has enlargement of the prostate can present with the same frequency and urgency that we were talking about, but the cause is mechanical, not inflammation or irritation like with an infection.
True. Wow. So let's talk about this special group of people, the youths. We're going to talk about this later, but let's say in Nairobi, there's super gonorrhea. Well, it's not a UTI to say, but let's talk about the youth. They're asking the question. I think many of them get treated in the hospitals as with UTIs. So what are these things that are happening in the background that is predisposing the youths to have frequent UTIs?
I think for the youth, like if you bring up something like super gonorrhea, this is when we need to clarify what is an STI, meaning sexually transmitted, and what is a UTI. You see, we've said a UTI, you might not even need another partner for you to get that infection, But sexually transmitted means partner A needed to have a pre-existing infection, whatever it is, whether it is gonorrhea, hepatitis, HIV, and we have things like chlamydia, etc. But partner A needs to be infected, whether they are showing symptoms or not, but they are infected. They then have to have unprotected sexual intercourse with partner B who didn't have an infection. And then now partner B starts to show the signs of that infection. That's sexually transmitted, And the thing that will predispose, so that's why when they go to the hospital, we have to be clear. Do they have a UTI, meaning an infection in the bladder and the urinary tract? Or have they picked up an infection in terms of, if it's a lady, is it a vaginal infection going to the uterus? If it's a man, it will still be usually a penile infection, okay? So we have to be clear, how did they get it? I think with youth, if they're getting UTIs, meaning urinary tract, a lot of it will go down back to the basics. The hygiene, the drinking water, being clear on are they being diagnosed with the right thing to begin with. If you have something in the genital tract, most likely the symptom you get is discharge. Yeah, different colors, different things, but it is discharge. That is different from a UTI. And what I see happening is a lot of ladies will go with discharge, meaning a yeast infection, and it's labeled as a UTI, which is incorrect. So if it's urinary tract, it goes back to what we're talking about, good hygiene methods, hydrating, making sure you're passing urine, making sure we rule out underlying issues. If it is anything like an STI, then the only thing that can transmit an STI is unprotected sexual encounters. So for that group of individuals, it goes back to us educating them and, giving them the methods and options they are to protect themselves, and also getting rid of the stigma, so you can go, whether it is to a university clinic or come into a hospital, and be clear about what your problem is. What happens is people come and say, I have a problem down there. Down there is a very vague statement, So the same way you can come and say, my nose is hurting and my lips, we should be able to have that discussion. Use the right terminology so you're clear where the problem is. A lot of things that happen is someone can go to a doctor, clinic, nurse and just say, I'm having a problem there. Oh, what's the problem? I'm itchy. Okay. No one examines you. No one does any tests. They just write you a general prescription, give it to you. They document it as a UTI. You go over the counter, get the medication. Maybe it works, maybe it covers it for a little while, or maybe 6 weeks later you're back in the hospital with something. So that's why even as you express, we need to be able to empower people to express themselves comfortably with their medical teams, knowing that medical teams are not there to judge you, they're there to treat it, for you to be able to say, this is my issue, to make sure that you get the right physical examination. A lot of things can be diagnosed just on examining. It doesn't always have to be expensive tests. To do the tests when necessary and give you the right treatment. We also have a thing here where if you came and told me I'm feeling pain, I'll tell you, oh, I felt that pain last week, my doctor gave me this. Then you go and buy the same, that very good friend exchange. Then you just go and buy that medication. Then maybe by the time you finally come to the hospital and see me, you're on your 6th UTI. Or maybe it was an STI that could have been treated early, but now we deal with the complications. So we have to be very clear on differentiating what is sexually transmitted and what is just a urinary tract infection that is not necessarily anything to do with person A having an infection that they have then passed on to person B.
Person B. Oh, that's good. Now, so just help us answer these questions to the youth still. Is a condom going to prevent UTI?
A condom will prevent a sexually transmitted infection. A condom will not necessarily prevent a urinary tract infection. Because of the physical friction that will occur during sexual activity, the bacteria that is on the outside of the skin will still have a chance to enter the female. The condom will probably protect the man from getting the UTI. So for the lady, it still goes back to hygiene. One of the things we encourage women is to make sure you go and pass urine after having sex. Make sure you take a shower. Basic hygiene methods. The condom will protect you.
Those ones are proven to help reduce.
Yes.
So passing urine?
Passing urine after sex. Good hygiene. Take a shower. Clean up. Hydrate. Those are the things that will protect you from getting a UTI.
What about vaginal douching?
I can feel my gynecologist friends getting upset. So I'm going to give a take home for all the ladies. Vaginal douching is just a gimmick. Okay, the vagina is a self-cleaning oven. It does not require any interference. It does not require any additional support. In fact, you are introducing chemicals into a place that they shouldn't be. Depending on what you are using, if it's anything mechanical, you can cause abrasions and damage on the inner of the vagina, meaning the vaginal wall, that next time if you were to have any unprotected sex, you're more likely to pick up an infection. There is no role for vaginal douching. Unless a doctor has prescribed something for you to insert, and that tends to be medicated, vaginal douching is completely unnecessary.
Great. Let's take a break. We'll be back with the conversation.
You are watching TV 47, the home of untold stories. Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
Sonadol Extra imetengenezwa kwa njia spesheli kupambana haraka na maumivu ya kichwa, mwili na hata meno. Sonadol Extra, hakika maumivu yakizidi, pata ushauri wa daktari.
Unataka kuendeleza the good times? Basi panda GoTV ikupandishe.
You always know what I want.
Ukilipia subscription ya package ya juu, unapewa upgrade to a higher package free. Panda tukupandishe, upate the best entertainment on TV.
This is the last.
Panda tukupandishe. GoTV, love it.
Are you looking for a college that will shape your future career? At Candy College of Beauty and Applied Sciences, we offer advanced courses with personalized attention to our students. Come and get your diploma or certificate in cosmetology, hairdressing and beauty therapy, diploma in community development and social work, or certification in catering and accommodation operation. We also offer diploma in nutrition and dietetics and many more. All of our graduates have secured employment in the job market, while others have gone into entrepreneurship. What are you waiting for? Join us today. For more information on how you can enroll, visit us at the London Beauty Building, 5th floor, Taveta Road, Nairobi, or call us on 0726 031 109 or 0784 515 606. Facebook, Candy College of Beauty and Applied Sciences, or on Instagram, Candy College of Sciences. Our January intake is ongoing. Candy College of Beauty and Applied Sciences is the cutting edge college.
Tonight, the food security situation in the country has deteriorated, with an estimated 6 million people in 32 counties greatly affected.
The government has had to reorganize its budget at the expense of many other programs and projects in order to mobilize resources needed to cushion millions of Kenyans from the effects.
This as President William Ruto calls for scale-up of interventions to tackle the current drought.
Calling out the Director of Public Prosecutions, Mr. Nurdin Haji's conduct is unbecoming. He has become a huge threat to justice, the rule of law, accountability and good governance in the country.
Also tonight, Azimio leader Raila Odinga slams DPP Nurdin Haji, says he is a threat to the justice system.
Matano ijao tutakwenda hapa Nairobi katika ile uwanja wa Jivanji hapo Nairobi kwenda kuomba. Tutakuwa na maombi na Wakenya wote.
This as Azimio leaders plan to hold interdenominational prayers in Nairobi. Plus, no illegal guns recovered so far in West Pokot, Turkana and Baringo counties, as operation to flush out bandits kicks off today.
You are watching TV 47, the home of untold stories.
Alright, welcome back to the Body Garage, the art of well-being. We are continuing with the conversation on UTIs. So, Daktari, let's continue from where we left. So we talked about vaginal douching, and we agreed that that does not help. In fact, it might make things worse and predispose to more infections and injuries. So just help us understand how you say the vagina is a self-cleaning
oven.
Yes, that one. Yeah. What do you mean by that?
You see, all your organs have been designed in a way to function without a lot of interference, okay? So the vagina in itself knows how to clean itself out. For ladies, and that's why it's important to have a gynecologist, to have regular follow-up. There is a natural amount of what we say discharge which is expected from the vagina that you don't need to do anything about. And women will know themselves, like in their cycle, when it is heavier, when it is lighter. The time to get concerned is if you're seeing a discharge that is thick, it is foul smelling, can even sometimes we say look like cheese. Usually that is a yeast infection. And that is what we call vaginal candidiasis, meaning that's a fungal infection. That is different from UTI. We're trying to get it clear, especially for the younger women, okay? When you have that kind of infection, like I'm saying, you're having a discharge, you're having a foul smell, usually that's why you need to see your doctor. There's a sample that's taken so they're clear on what they are treating, okay? And you don't need to do, there's no special cleansing that you need to do to sort that out because it is an infection that needs medication, all right? Again, I go back to basics. A lot of times to make sure you don't get that, you need to be very good with your hygiene, cleaning well, making sure the kind of underwear you're wearing is clean, and this goes back for men and women, hydrating well, There are no special foods that are going to help you, Your diet needs to be well balanced. That's what all of us need. Everything in moderation, Again, making sure that your immunity is at a good level. The irony can be, you can come to be treated for a UTI, which I've said is bacterial. You're given an antibiotic, and later on, women find they develop a yeast infection. So how can it be that I treated the UTI and then you got another infection? Antibiotics a lot of time are not discriminatory, meaning it can treat most bacteria. So as it is killing off the bad bacteria, we realize we always have to have good bacteria in our system. The antibiotic will also wipe that out. And remember that certain level of good bacteria makes sure that other things are kept in check. So when you get rid of the good bacteria, the yeast that was sitting there now gets a chance to get an overgrowth. So you'll find there's a subset of patients, even if you admit them for antibiotics for anything else, ladies, you'll find as a consequence of the antibiotic, they get a yeast infection that you still have to treat. So it's to be clear that a UTI and an STI and a yeast infection are different. Even for clinicians, as we document, we need to be clear what we are treating. So like we were saying, there's a difference if you have a problem with your nose and you have a problem with your mouth, even if they're on your face. And that's how we look at it with the UTIs and the STIs.
So even the people should stop saying, when you come to the hospital, down there. You should be specific.
You should be specific. If you can say my ear hurts and my nose hurts, then we need to be clear. And for clinicians, I would say examine your patients. You need to examine and see.
All right.
Even if someone is shy, we do it correctly, meaning if a male needs a male doctor, and obviously with a chaperone, if a female needs a female doctor, with a chaperone. But if we don't destigmatize things, we will continue to have the same conversations about the same things in and out.
All right. Let's move on to treatment. So I am at home, I have these symptoms that you described, so what should I do? You can walk us through them.
Okay.
How is it called? In the hospital, it's called patient flow.
Patient journey. So if you're not feeling well, whatever it is, you are uncomfortable, you come into the hospital. You sit with your doctor, explain what you're feeling. Whatever you're feeling. I'm having pain when I pass urine. I'm seeing blood in the urine. I'm having pain in my back. Like a lot of times, don't come and say, I have a UTI. Because then you might get someone who's like, okay, it's a UTI, and it ends there, Just come and say what you're feeling and say it in the words that you have, okay? Insist on examination. Don't agree to just talk to a doctor across and have something written, usually your doctor will guide you whether they feel they need to do the urine test. And a lot of times, you see, the reason you do a urine test is you can have cells in urine, because even the way you collect the urine sample, you can scrape along your skin and get some cells. That's not the same as having an infection. There are parameters the doctor has to see on that test to say it's an infection. Be honest with your doctor, meaning when you're being asked, have you had sexual contact? How many partners do you have? Is this your first infection? It's better to be honest. There's no judgment, but that guides the testing and the treatment, okay? Usually if it's a first time, sometimes even the doctor can opt to just treat, meaning giving you a general antibiotic based on what we know is in the community. But you need to be reviewed. Not you take the antibiotic, you feel better and you get on with your life. Always come back, even if it's just for us to know you have responded well. Sometimes you can be given something that kind of helps flush out the urine, what we call an alkalinizer. It can be a tablet, it can be something you dissolve in water and drink. It's just to help change the acidic levels in the urine, so to help aid in killing the bacteria. Cranberry juice has been shown to help. It just stops the bacteria from sticking on the inside of your pipes, so to speak, and you need to hydrate really well. Sometimes your doctor does something called a culture. Now a culture means we take whatever sample you've given, we keep it in the lab and we let it grow. As it grows, by day 3 or day 5, it tells us exactly what bacteria.
The type of bacteria.
Exactly. So it'll tell us this is E. coli, this is this, whichever it is. And at the same time, it also tells us what antibiotic is that organism sensitive to. But you see, I can't leave you for 3 days feeling sick while I am in the lab waiting for results. So usually you get, the test is a urinalysis, meaning we get a result exactly then and there that tells us how many cells are in the urine, does it look bacterial, things like that. You're started on treatment and you're asked to come back within 3 days while the culture is coming out. That way we see, have you responded to the medication? Did we put you on the right medication? Remember, if you have taken antibiotics before you come, it can interfere with that report because you might have suppressed the amount of bacteria available for that culture, which is why I say it's important to be honest with your doctor. Even if you've gone over the counter and taken medication, take a photo or keep a little part of that box if you can't remember what you were given. You know, we have a lot of companies these days, but at least your doctor is able to know which group of antibiotics,
so they keep a record
of what you have taken. Then at least when you're coming for your assessment, then we know, have you responded? Are you on the right treatment? Most antibiotics, you don't need long courses. In terms of antibiotics these days, we're now saying shorter is better. So we're trying, if something can be given tablet instead of injection, we'd rather give it as tablet. If something used to be for 10 days, we want to see, can we give you for 7 or 3 days? Or some antibiotics, you can even give 1 dose to clear out the urine. Because we want you to finish your medication, not get better in 2 days and then say, these remaining 3 days I don't need to take the medication. And then once you have been treated, at least there is a record. I usually advocate it's good to go back. If you ever fall sick again, it's good to go back to the first place. Nearly 30% of people who have a UTI, again women, within 6 weeks have a recurrence. And sometimes it's the same bacteria because either they didn't complete the dose, they didn't go ahead and put in the hygiene measures and things. You know, human nature is very forgetful. Once we feel good, we put it aside. So if you're looking at least 3 out of 10 of the women you see are going to come back within 6 weeks, it's better to go back to the first facility that you were, especially if you felt the level of care was good. No. The reason we advocate for regular care, you see, once you know, you come and see me and I'm Dr. Shamsa and I know you, next time you come I know. And I have access to your records that I can say this was this and this is what we did. Every time you go somewhere else, you might find you're starting afresh. I mean, obviously if you're dissatisfied with care, you always have the room and right to find somewhere else. But at least the second visit, you try with your first facility. And usually if you get a second UTI, my advice is if you have been seen in an outpatient center by maybe a medical officer, I think your next visit needs to be with a specialist, meaning a consultant at that point.
Great. So just to recap, so you have the symptoms, you go see the doctor, get examined,
They
so
do
the basic test will be a
urinalysis and a urine culture.
Those are the basics.
Those are the basic.
All right.
Blood tests only if you're showing symptoms of a body infection, meaning from a urine infection, it has gone on so much that it's even getting into your bloodstream, and now you are sick, having fevers, maybe vomiting, dehydrated, maybe we're even considering admitting you. That is when you need next level testing. That can also include a scan of the kidneys and the bladder.
Yeah, good. And then now treatment with the antibiotic and the alkalizer and the
hydration
and
good hygiene. Yeah.
All right. So let's go to the last bit because of time. Resistance. There is this campaign every now and then, antibiotic resistance. I think it's worth our time. Let's talk about what is this thing.
In fact, WHO has now classified antimicrobial resistance as the next pandemic. Okay, it is in the top 10 list of the things that even the World Health Organization is worried about.
Yeah.
You see, unfortunately, in continents like Africa and Asia, our rules are quite lax. Meaning I can go in and tell the pharmacist, I'm feeling this, and they can give you an antibiotic.
Like
we've all done
the
it.
Best.
We've all done it. Just give me the best.
The best.
I don't want to see the doctor. I don't want the tests. I don't want to use my insurance. So I just want something. Now the problem with that is you are given a general antibiotic which might treat or cure. But if we keep giving out antibiotics like sweets and water, remember these microorganisms in the community, whether it's bacterial, fungal, whatever it is, every time they get in contact with the antibiotic, they become smarter. They develop what we call resistance. They see how to fight against the antibiotic. So before maybe it could kill 100%. Now it goes on to 70%, then it goes to 20%. Soon, even if you were to take that bacteria and dip it in a bucket of that antibiotic, it's like putting it in water. There's nothing that happens.
The bacteria is stronger.
Yes, and one thing that happens also here, you see we use a lot of antibiotics on our animals. So remember the meat that we eat is already antibiotic based. So you get antibiotics also indirectly from apart what you're taking. Yeah. So when you have this thing that you're constantly surrounded by antibiotics, all that happens is the bugs you have become stronger, which is why I tell you hospital infections are always worse than what you'll pick outside, because here we have the best of the best. And then when you lose one antibiotic, we say okay, but when you lose 2 or 3, that means that bug now becomes multi-drug resistance, which means now I can only use IV antibiotics for long courses, very expensive. And then next I tell you what we call XDR, meaning it doesn't respond to any antibiotic. It is also unfortunate that you see pharmaceutical companies at the end of the day will manufacture new drugs based on what they'll make money off. So the money is with diabetes, hypertension, those kind of things. The money is not with infection. So we don't get, you see, if you look at the market, every 2-3 months there's a new drug for diabetes, hypertension. You don't have that for antibiotics. We're using some of the originals which have been going on for 100 years. So we have to safeguard those drugs. And the only way to safeguard is to make sure we know what we're treating and give the appropriate antibiotic.
That's what I wanted to ask as we wrap up. So what are the, we can use the word safe antibiotic practices, both on the side of the practitioner and the patient?
So for the practitioner, you need to know local data. You can't be working with data from the US. You need to know what is prevalent in Kenya, what is the resistance. We have been using something called fluoroquinolones, ciprofloxacin for UTIs for so long. We have a lot of resistance now. Most hospitals have local data for their areas, what we call an antibiogram. So a hospital should have a protocol of patient with UTI. These are the steps done. These are the antibiotics that can be used. For the patient, you need to know your rights. It's nice, it's a shortcut to go to the pharmacy and get something, but unfortunately, the same person in 5-6 years, you'll be in hospital with maybe a pneumonia, and because you took that antibiotic for this UTI 3-4 times, I can no longer use it for your pneumonia. So know your rights, seek the right treatment, be very clear with your clinicians, and if you're not comfortable, always get a second opinion.
All right. So does failing to complete antibiotics lead to resistance?
Yes, it does.
Does taking antibiotics for longer period lead to resistance?
Yes. all medications have risks and benefits. So things are supposed to be at the right dose at the right time. So if we play with that, remember anything you give, there's a cycle of antibiotic, cycle of bacteria. So you're always trying to make sure that our cycle is winning. If you interfere, then the other side always gets a better chance.
Great.